Hello and welcome to the College of Education and Human Sciences Health Science Degree Program presentation. My name is Mason Martin, one of the prospective student coordinators for the College of Education and Human Sciences. I'm really excited to share our opportunities with you today through this presentation. First things first is why should we study health within the College of Education and Human Sciences? We have the largest concentration of human health programs on OSU's campus, with over a third of our student population pursuing a health-related degree. We also have expert faculty who are healthcare practitioners bringing relevant research into the classroom. What that means is a lot of your professors are going to have real world experience. Maybe they were a practicing dietitian or an advanced researcher pursuing a postdoc doing something really cool, or maybe they have a ton of field experience and they're a clinical faculty coming in to show you what it's really like. It's really going to benefit you to have that reference and frame of mind for what the difference between a classroom experience is and what your practicing experience is going to be. With that, what your practicing experience is going to be, we actually make you practice. You have an integrated practical experience in each of these degree programs, meaning that we're going to make you get an internship or shadowing experience to count for parts of your degree requirements, meaning that you're going to see in the field what your major looks like and what someone who graduates from this program, what their career looks like, what could you potentially do. It's really a great opportunity to have that internship building under your belt because it's going to set you apart not only for graduate schools, professional schools, things like that, or even just entering the job market because you've seen it. You have a real world frame of reference, whereas someone who didn't pursue an internship experience may not. Our next opportunity is the opportunity to participate in undergraduate health research with faculty. OSU takes research very seriously, and we will have a full slide dedicated to undergraduate research opportunities here later. Finally, for our students who are interested in pursuing medical school, all of our degree programs qualify you for a guaranteed med school interview with OSU College of Medicine if you meet the minimum requirements. So that is a 3.5 and their prerequisite list on their GPAs. And so if you do really well in your undergrad, you can potentially set for that guaranteed medical school interview. That's a really nice feather in your cap because even if that's not where you end up going to medical school, it's really nice to know that you could potentially guarantee qualify for an interview because getting into medical school is hard and that interview is going to be really valuable for you, even if it's just practice, is a year frame of reference for it. And so we're really excited that our students are so well prepared to be able to pursue that opportunity. Before we get started, we're going to be going through 4 degrees with 9 study options. In all of these degree programs, you must love science and you must love learning. One thing that I do want to touch on before we continue is that a lot of these degree programs have overlapping opportunities through their different options. So through several of these degree programs, you could go on to physical therapy school. Through several of these degree programs, you could go on to medical school. Through several of these degree programs, you could become a public health specialist. You could become a advocate for your patients. You could work in a social field, things like that. So there's a lot of overlapping opportunities. Why do I bring that up? I bring that up because there's no best way to get towards your professional school goal or your ultimate career goal. What our goal here is today is we hope to find you an undergraduate degree that you love, because if you don't love what you study for 4 years in the hopes to get to that professional school, whether it's PT, OT, MD, DO, whatever it may be, you're probably not going to enjoy it. And we want you to actually enjoy what you do. And we want to give you career opportunities that maybe if your interests change, maybe if you realize, I actually want to go to OT school, not PT school. We want to give you diverse opportunities and we want to make sure that you aren't pigeonholed by your degree. So these degrees are very broad-based. They have a lot of opportunity available to them. And what the best way to get to your professional school goal or your professional goal is to study hard, study well, be a leader, do good things on campus, do well in the classroom, be a good person outside of the classroom. That's how you get to professional school. It's not going to be, well, he was an applied exercise sciences major. Well, she was a nutritional sciences major. That's not going to be the consideration. What's going to be the consideration is how well did you do in the prerequisite courses? How well did you do in your classes? And what did you give back to your community? Okay, with that being said, let's get started. First degree that we're going to talk about is Applied Exercise Sciences. Applied Exercise Sciences is applied anatomy and physiology and neuromuscular science related to exercise and health. What does that mean? We're going to study every aspect of how our health and movement are related. How does the fact that we have a hurt shoulder impact the rest of our body's ability to respond to stimuli? Does it affect our gait because we're kind of limping on that side now because it hurts if we take too hard of a step? Things like that. Applied anatomy is how we use energy, or applied exercise sciences is how we use energy. It's how our body moves through the motions. It's pretty much everything that goes into that. There's two study options. So there's pre-professional or strength and conditioning. Pre-professional should really read pre-medical, pre-dental team because it's going to have a lot of those more courses such as organic chemistry that you're going to need to get into medical school, whereas strength and conditioning does not. Strength and conditioning is more geared towards our PTs, OTs, people who want to go on to be a strength coach, things like that. Because the strength and conditioning option, it's not an easier path. It just has classes in it that are avoided that you wouldn't need if you weren't going on to medical school. Applied Exercise Sciences also has an agreement with a 3+2 Accelerated Athletic Training Master's Program at the OSU Medical College in Tulsa. So that's a really cool opportunity for our students. With that program though, and we'll bring it up on one more slide, but with the 3+2, you're not cutting a year off of your degree. You are cramming a 4-year degree into 3 years. And so you're going to be taking classes fall, spring, summer for 3 years. It definitely will get you through that master's program quicker. You'll have a master's in 5 years rather than 6. But I just wanted to make that clear before we move on through it. So some of the career paths that our students can follow into this is pre-professional, just anything that you can think of: PT, OT, physical therapy, physician's assistants, occupational therapy, chiropractic medicine, anything like that, as well as athletic training, athletics and physical equipment industry, becoming a strength coach, working with a football team or basketball team, going in, doing and opening your own gym, working with clients, developing workout plans that best work for them. There's a ton of opportunities for you as a student and graduate from Applied Exercise Sciences within that range of. Our next slide is health education and promotion. So health education and promotion is everything that goes into your health that is maybe from an outside source. So your physical health, your mental health, how does your physical environment impact your health? Anything that can influence the health of an individual, community, and society. So this is more of a social aspect of medicine than what people typically think about as an opportunity for a person to study within the health realm. So the classes that you'd be taking are classes in things like disease prevention, alcohol and drug education, epidemiology, courses like that to really make sure that you understand the broad range of things that impact a community and person's health. There's 2 study options with 15 hours elective customized towards your programs of interest and pre-professional requirements. So you kind of decide what your path is going to look like with those 15 credit hours, which is really cool because it sets you up for availability to go into a lot of different fields with that. This also has that 3+2. That's the second time that I was going to mention it. So remember, we're not cutting off a year. We're doing a 4-year degree in 3 years and then moving on to our master's. So what are some career opportunities with this? You can become a public health official. You can work in epidemiology, biostatistics, healthcare administration, mental health, moving on and becoming a licensed professional counselor, things like that, going on to medical school. So there's a ton of opportunity for you as a graduate of this program to work in a lot of related health fields that people just tend to not think of. Nutritional Sciences. So Nutritional Sciences is applied chemistry and physiology related to the human diet and your body's creation and use of energy. So this is how I always compare and contrast Nutritional Sciences and Applied Exercise Sciences. This is how we make energy. Applied Exercise Sciences is how we use energy. Nutritional Sciences is also going to study how we use energy, but Applied Exercise Sciences is how your body actually puts that energy into motion. So that's kind of the difference between these. This is definitely a heavy lab focused course of study because you're going to be learning a lot about chemistry and how your body actually breaks down the nutrients that you put into it. How does having vitamin A prevent this disease? How does beriberi actually happen in your body? What is scurvy? Is scurvy something that can really happen to you? The answer is yes, eat your vitamin C, things like that. But nutritional sciences, 50 to 80% of the most prevalent diseases in the United States are related to nutritional deficiencies and exercise related deficiencies within the human health. So you are going to become a better physician or a better advocate for your patients, working with PT, OT, whatever that is, if you come through the nutritional sciences department, because you're going to understand all those underlying risk factors that are associated with nutritional deficiencies. So with the nutritional sciences option, there's 4 study options with pretty distinct career path opportunities with them. So that's kind of why we broke them out like this. So the first is allied health. Allied health is preparation for, I want to do something within the healthcare field, but I don't want to become a physician or a dentist. So this is pharmacy, optometry, chiropractic medicine, nursing, PT, OT, PA programs, anything like that that is a part of that allied health team, but is not the physician or the dentist. It's a really great option because you can really pick your career out of it with a strong scientific base, but you kind of gear it towards what you like. And it's really nice to be able to have that flexibility to do that. Community nutrition is a public health specialist focused within the nutritional realm. So these would be people who work with community nutrition programs, such as Meals on Wheels, elderly feeding stations, things like that, in smaller communities where they have a daily meal served for the elderly community to come out towards. They may work with a nursing home to make sure that proper requirements are being met, things like that. That's what a community nutrition person would do. Dietetics is the path to become a registered dietitian. So the registered dietitian is an allied health professional who is trained specifically in how the body interacts with food, how can we develop healthier relationships with food, how do our nutritional deficiencies impact our overall health and wellness. So unless someone is a physician or a dietitian, they really aren't qualified to speak on nutritional deficiencies as well as someone who could be trained in this. So these are going to be the people who are actually determining what is the caloric makeup of this food that you're ingesting. How does your body process this food? How does your body break down the vitamin A that's in this to make sure that it's being properly used? Or is it made in such a way where your body can't get that nutritional goodness out of it? Dietetics is a really cool field. With it, though, it's important to note that dietetics is a 6-year plan because you are required to get a master's degree from a dietetics program to become a dietitian. So you have to do 1,000 hours of an internship and then complete a master's degree. A lot of them will do those consecutively, and some programs are built for that, but it's just important to let you know that it's not a 4 years and done kind of thing. It's a 4 years plus a master's. Finally, the last one is human nutrition pre-medical sciences. This is the I want to be a doctor, I want to be a dentist path. This is a really great opportunity. I think the best thing to say about this is that in 2018, we had 100% placement to med school from this degree program of a pretty large class. And so once again, med school is hard to get into, and our students were well prepared to meet that rigor and challenge, and were successful in that. Recreational therapy, you may not be familiar with this unless your family had a use for a recreational therapist. So what do recreational therapists do? They apply mental, physical, and occupational health principles through recreational interventions with clients. What does that mean? They use the principles that mental health professionals, physical therapists, occupational therapists, people who work in those fields would, to work with a client who may not respond in the traditional way to their treatments. So for example, if you have a really young person or someone with a mental disability or someone who's really old and kind of over it all, working with a PT, they might not respond whenever that PT tells them to do shoulder pulls like this to make sure that their shoulder quits hurting. They're going to go, ouch, that hurts, never doing that again, and lose processes in that shoulder. So they would bring in a recreational therapist to help develop a treatment plan that would take their mind off of the fact that they're being forced to get better. So instead of doing this, maybe we're shooting a basketball. Instead of, if we needed an occupational therapy intervention, instead of writing our names 100 times, try and get that fine motor movement back, maybe we build puzzles or we finger paint, things like that. A recreational therapist just uses those same principles in a fun way that's going to make them engage with the therapy a little bit better. We are the only program in Oklahoma that offers recreational therapy as a degree. It is a nationally accredited program, and we actually have core faculty who are leaders within the national organization with Dr. Tim Passmore. We also have our graduates from this program who complete degree requirements will meet the requirements to take a national certification exam and pursue state licensure. So after a 4-year degree, you can go and work in a hospital as a recreational therapist. You can go and actually practice, and it's a really cool opportunity for you for that. One of the certifications that you'll leave here, as well as with recreational therapy, is that you can leave here with your warm water therapy certification. And it's a really cool opportunity for you to be able to use as a repertoire in your therapy. So some possible career paths: you can be a practicing recreational therapist after 4 years, or you can go on to graduate studies in physical therapy, occupational therapy, mental health counseling, public health, or you can get a graduate degree within recreational therapy. So there's really, the sky's the limit with this degree. It's a great option for those who are interested in becoming a physical therapist or an occupational therapist, just because it makes you think like a therapist a lot earlier than you traditionally would. So what is the student experience like within our college? Our college has hundreds of ways to get involved. We have a major related club for everything. Here's just some of our health related clubs, Health Connections Club, Health Promotion Club, Nutritional Sciences Club, Rec Therapy Club. Those are just within the college. University-wide, we have a pre-health club, we have a pre-PT club, pre-OT club, medical brigades. But those are just a flavoring of some of the organizations that you can get involved in at OSU that are specifically related to health. OSU has over 500 organizations that you can become involved with. So definitely find something that you're passionate about, get out there and be a part of it. It can be even just something like the Cat Club, who gets together and they volunteer at Tiny Paws shelter here in Stillwater. It can be that. It can be the entomology club if you're really into bugs. Whatever it looks like for you, get out of the classroom, get involved, make good friends. Undergraduate research, I told you we bring this back up. Undergraduate research is a wonderful opportunity for our students, especially interested within the healthcare field, because it's going to really set you apart as you consider going on to graduate study. Undergraduate research is sometimes scary to students because they think you've got to be a super brainiac to do it. But you have a lot of faculty mentorship and opportunities to make sure that you are the best prepared that you can be to pursue these opportunities. So whenever you go in to pursue a research project, you're probably tag teaming with a professor who's mentoring you all along the way on a project that you designed, or you're piggybacking off of a project that they're working on. So there's a ton of opportunities for connection. You really get to know them in a more one-on-one way, because now you're not just a student in their class, you're someone they're working with to develop a project. Really, at the end of the day, research is just, I have a question and I want to find the answer. So research can take many, many different forms. One of my favorite research opportunities that I know about from our college is we actually had a fashion design student who participated in research with the Applied Exercise Sciences Department, measuring the different heights in heels and how they affected women's gait. So she had a question, she developed a project and with faculty mentorship and found an answer. And so with this opportunity, she was able to get to know her faculty within another department, and really make an impact with that research. And so with these research opportunities, you're not just doing it and being like, oh, cool, I'm done with it. As a D1 research institute, OSU has a lot of opportunities to make this research go on to really cool places. My student worker, Courtney, actually was able to present her poster from a research project in Applied Exercise Sciences and presented at a regional conference with representatives from about 6 different state associations coming to talk to her about her research in applied exercise sciences. She did that as a sophomore. There's really cool opportunities available for you to do some really cool things. OSU has a lot of scholarship opportunities available for you to do that as well, with the Freshman Research Scholars Program, as well as you may be able to get course credit or extra credit in your class if you help out a professor sometimes. So it's a really great way to make sure that you're getting the most benefit, but you're also benefiting your future self with undergraduate research. So if you're interested in these health careers, I really encourage you to talk with us or your advisors about the opportunities available for you for undergraduate research. Okay, that brings us to the end of our slides. If these sounds like things that you're interested in, congrats, you're in the right spot. Regardless, though, we'd love to hear from you. So feel free to reach out to me or my colleague, Jennifer Chesmore, at the below number and email, because we'd love to talk about what you pursuing one of these degree options looks like, what it's going to look like for you to become a cowboy. So don't hesitate to reach out. Our phone number is 405-744-6350, or you can email us at educate@okstate.edu. Thank you for joining me today. Have a good one, and go Pokes.